happens when you take a pill for your headache? Tell me exactly what you do. And they'll usually say, well, I take a Tylenol and I get a glass of water and I drink, I'll swallow the pill. And then I say to them, well, that's interesting. Does your headache go away? And they say, yes, usually, my headache goes away in about 10 to 15 minutes. And then my next question is, well, you swallowed it, but yet it worked on your headache, which is, in your neural tissue. And that starts to help them unfold the fact that food, in a very similar way, is something we eat and is digested in our gut microbiome and our entire digestive tract, but it also can impact other parts of our body, but also, very importantly, the brain.
So to tackle this global mental health crisis, there are some tools that we all have access to, and one of them is food. So I'm therefore thrilled to welcome Dr. Naidoo to talk to us about nutritional psychiatry. And who better to do it than Dr. Naidoo? Dr. Naidoo is a board-certified Harvard nutritional psychiatrist, professional chef, and nutrition biologist. She's the founder and director of the first and only hospital-based nutritional and metabolic psychiatry service in the U.S., which is housed at Massachusetts General Hospital. Dr. Naidoo also serves as the director of nutritional psychiatry at MGH Academy, for which she designed and released the only CME-based nutritional psychiatry educational program for clinicians. Additionally, Dr. Naidoo serves on the faculty at Harvard Medical School, the Harvard Department of Nutrition, and is an instructor at the Cambridge School of Culinary Arts. Dr. Naidoo frequently speaks at conferences around the world and is a regular contributor to major media and news outlets. Her first book, the international bestseller, This Is Your Brain on Food, has been published in 22 countries and 18 languages. And she's about to release her next book, which comes out in December, Calm Your Brain with Food. So I'm so thrilled to have you here, Dr. Naidoo. Welcome.
Welcome, everyone. And thank you for being here. I'm here really to talk about my area of specialty and my niche focus of my clinical work and research, which is nutritional psychiatry. And I wanted to touch on a few things today, very much about anxiety in the world. And I think it's something that resonates with many of us in the midst of this mental health crisis, but also where nutritional psychiatry can be useful in other parts of mental health. So I'm the director of nutritional and metabolic psychiatry at Mass General, and I really had the opportunity to start my clinic several years ago, and an opportunity to work with individuals who specifically wanted to work with me in this niche area of using nutrition for mental health. This does not preclude the use of medications or very important life-saving psychotherapies, which I still very much support. So I wanted to make sure that we understood the perspective from which I come. Now, nutritional psychiatry offers clinical guidelines based on nutritional science, which, by the way, is ever-changing. But the evidence-based research for the use of healthy whole foods and nutrients to improve mental well-being. Years ago, I was featured in a Wall Street Journal article, which was very popular. But one of the things I took away was a very important point that the journalist interviewing me kind of pulled as a thread from something I was saying. And what I had explained was that it's not about 10 milligrams of Prozac or 10 blueberries. The food and nutrients that we eat do not replace medications or other important therapies, but they work in synergy and really offer broader options to improve mental well-being, almost like having more tools in the toolkit. Something with the level of resources, despite telehealth, still being not enough for people, and understanding that globally more than 70% of people with mental illness receive no treatment from healthcare staff at all. This was published from a study in 2013, and it was actually as telehealth was really emerging more rapidly. But even then, you can imagine if you put us post-pandemic, that those numbers have definitely increased. So we need more tools in the toolkit. So why is nutrition that important? Well, we have a public health crisis, and bad diet is actually the number one cause of poor health in the United States as well as worldwide. And it's something that we can fix, and we can fix it because we all eat. We eat at least once or twice a day, depending on what pattern of eating you follow. But all of us eat. And it's such a low-hanging fruit in terms of us being able to make a change and make a positive change, especially for our mental well-being. Now, in terms of the anxiety pandemic, my book that's being published in December is Calm Your Mind with Food. And the reason I chose this topic was because one of the most overarching conditions I saw throughout the pandemic and beyond has been anxiety. Many people don't realize that anxiety disorders are the most common mental illness in the entire world. Was updated with recent data during and post-pandemic. After COVID-19, anxiety disorders grew by about 25%, meaning that from about 298 million people affected, this grew to 374 million people. This was published in Lancet, an extremely reliable journal. So another important factor is that the American Psychological Association reported that about 3/4 of adults report symptoms of stress. So we understand that this is an issue. We understand that many people are suffering. We know that during COVID, research published by the CDC in the middle of 2020 showed that there were so many Americans actually were thinking about suicide and were feeling very desperate. So not only the impact of the pandemic, but something about the pandemic also uncovered the real crisis that has been ongoing in mental health. Now, when we take a step back and we look at the biological mechanisms in nutritional psychiatry, several different mechanisms are being explored and researched. The one that I feel brings it home for most people as one of the ways to understand it is the gut-brain connection. I often say to people, well, especially when I'm asked, well, how does food impact my mental health? And a lot of times when people are thinking about food and nutrition, they're thinking about their waistline, they're thinking about their weight. They're not necessarily thinking about their mental health. And this is the very important niche that nutritional psychiatry fills. But I'll say to them, what happens when you take a pill for your headache? Tell me exactly what you do. And they'll usually say, well, I take a Tylenol and I get a glass of water and I'll swallow the pill. And then I say to them, well, that's interesting. Does your headache go away? And they say, yes, usually, my headache goes away in about 10 to 15 minutes. And then my next question is, well, you swallowed it, but yet it worked on your headache, which is, in your neural tissue. And that starts to help them unfold the fact that food, in a very similar way, is something we eat and is digested in our gut microbiome and our entire digestive tract, but it also can impact other parts of our body, but also, very importantly, the brain. So just a simple way to kind of start to unpack that for people. Now, Hippocrates was onto this eons ago, and he said that all diseases begin in the gut and death sits in the bowel. But the modern science, nutritional science, microbiome science, the understanding of the gut microbiome really had to follow so that we could understand this both from a research perspective as well as clinically. So now when we look at nutritional targets in foods and nutrients, I think what's important to understand here is that nutritional science is ever evolving. We want to understand the role of the neurotransmitters, especially where they are so closely located with the gut microbes in terms of what we're doing and what we're eating and the food that's being digested. So it turns out that when we eat a healthier diet and we eat, those leafy green salads with lots of clean proteins and fiber and vegetables, nuts and seeds, healthy fats from avocado, olive oil, etc. And it's generally just a healthy meal. The breakdown products of a healthier meal are what's called short chain fatty acids, and sometimes you get production of bile acids. But recent studies have shown that the metabolites produced by the gut bacteria or microbiota also include some neurotransmitters such as glutamate, GABA, serotonin, and dopamine, many of which implicated in mental health. Now, as these neurotransmitters such as glutamate, GABA, dopamine, serotonin, they actually cannot penetrate, they cannot get through the blood-brain barrier. So they have to actually be synthesized inside of the brain from their neurotransmitter precursors. And most of these precursors are amino acids. So think about things like tyrosine and tryptophan, all of which have to be derived from the diet. And when you consume these foods rich in these amino acids, they actually allow for the development of these neurotransmitters in your brain. So that's, I think, helpful for people to understand, because the tyrosine and tryptophan derived from the diet enter the blood and can be transmitted across the blood-brain barrier. And so they are then taken up by the corresponding neurotransmitter producing cells, and you get the production of some of those neurotransmitters. So just something that I think is helpful for people to understand. Years ago, we didn't understand the science to that level. And so it's ever evolving, and we're learning and understanding a little bit more as more research is done, and we kind of more comprehensively understand the process. Now, people often say to me, well, where should I start? What do I do? How do I correct, how do I help my mental health? I think it really starts with an overarching examination of how we're eating. A simple questionnaire or simple conversation with someone about the different food that they're eating. Has their diet changed? Maybe they've changed jobs, locations, moved. Maybe they're working from home or a hybrid model, or back in the office and the cafeteria no longer exists. So all sorts of things could be affecting that. Now, one of the things that also happened during the pandemic is with the, understandable panic that happened in March of 2020, where there's some March and April actually, store shelves were empty in the United States of certain foods, not all the shelves. This led to a certain level of panic in people. It also led to food companies increasing the level of processed foods they were producing, because there was an increased need. And people just went out and bought a lot of processed, ultra processed foods, which are shelf stable. And so I think with the fear of running out of certain foods, they stocked up on these. And processed food sales in the United States have remained high from the beginning of the pandemic, and have continued to remain high. So it's almost as though we haven't necessarily course corrected on that. So I think just understanding what someone is eating and what is their dietary pattern on the given day becomes important, because there's always this path towards the French fries, and the French fries in the United States have added sugar, which you can't taste, but research and development, millions of dollars of research and development has gone into making them hyper palatable. So you want, when you go to buy those fries, you want the biggest size, you upsize. When you buy the bigger size, you eat the whole thing. And then the next day you're wondering, at lunchtime, why didn't I go get more of that food? So it really taps into certain craving cycles. As I say to everyone, once in a while, you're running through an airport, you're traveling, you don't have time for, that delicious salad or something more healthy. It's an option to eat, and no one is going to consider that a crime. We have to be flexible, and it's a principle in nutritional psychiatry I strongly believe in. The 80-20 rule, which is 80% of the time we do our very best to make those healthy treats and eat the foods that are more healthy for us, but 20% of the time life happens. You might take your child to a birthday party and be offered a cupcake. You may be running through an airport and be hungry and need to get a fast food meal. Whatever it is, I think it's really about finding the ultimate way that you can nurture yourself back to your better mental health in a way that is sustainable and doesn't have hard and fast fixed rules, because that can be very hard, like I said, to sustain. Now, I wanted to share this study because what was really important here is we've talked about what the gut microbes do. We've talked about the effect that they have and their interaction with neurotransmitters. We've talked about how they are in the same environment as the neurotransmitters. But this study I thought was really helpful because it was done in mice. And what it showed was that when carboxymethylcellulose, or CMC, is actually used as a food thickener, especially in processed, ultra-processed foods, it thickens food. And this study basically showed that when this dietary emulsifier thickener is in certain foods, it impacted the gut microbiota and metabolome of these mice. And they were unable to produce enough short-chain fatty acids, which are those positive breakdown products of food that we want to help with the gut environment. I think that's helpful to know because it makes that connection to the fact that this, again, it was an animal study, but makes that connection to the fact that there was this direct link between that type of food that was fed to the mice and the impact on the gut microbiome and the production of short-chain fatty acids, which we definitely need to keep a healthy gut microbiome. Now, when we think about nutrition targets, we went through a few conditions and I touched on different foods, different nuances in each condition, like depression and nitrates from processed, ultra-processed deli meats. But there are also nutrition targets that I think are through lines through different conditions that are super helpful in reducing inflammation. Prebiotic foods, these are very easy to obtain. Garlic leeks, onions, oats, bananas, and more are actually prebiotic foods. So with a lot of these, you may look at them and think, oh, I have to go and take a fiber supplement or prebiotic pill. You can actually get a lot of these from food. And what I like people to do is tweak their diet slowly over time to just include these in a natural way. Fermented foods, there was a very elegant study published in Cell in summer of 2021 from a research group at Stanford University in the United States. And it really looked at the use of fermented foods and how fermented foods helped to lower inflammation in the gut. So adding in fermented foods like kimchi, kombucha, miso, and so many more, kefir, all of these can actually, in a sort of steady way, help to fend off inflammation in your gut. So adding them in, being aware of where you're obtaining them and the level of added sugar and things like, say, kombucha, which is now highly commercialized. And a lot of the commercial versions have a lot of added sugar in them. So just check the food label. I think that the only way we can manage that is to understand those things ourselves, as well as finding ways and different types of fermented foods that you can consume and that you like the flavor of. Fiber is something that is a vital nutrient for the gut microbes, but fiber is a nutrient that is only found in plant foods. It's found in vegetables, fruit, beans, nuts, seeds, legumes, and healthy whole grains. It's not found in animal or seafood proteins. Now, we know that a lot of research has pointed to the positivity of the Mediterranean diet or plant food diet or plant-rich diet. And I think that one of the factors that definitely plays into the positivity of those outcomes is the fact that the fiber is so important for managing the gut microbiome. So a healthy balance of, plant, if you consume animal and seafoods, a healthy balance of these different proteins, but the fiber from plants and fruit is super important. Clean proteins, if you're vegetarian, something like tofu, tempeh, or poultry, beef, seafood, we know that fatty fish are very rich in omega-3, so those are always good options. And then, these different groups here really become nutrition targets. So I want people to almost start to build their nutritional psychiatry plate after we understand what tweaks we need to make, and we do them slowly and steadily because it's a marathon and not a sprint. This is how we want them to build. Now, I want to just mention fiber because fiber also comes from things like whole grains. And I think it's where we get the source of our whole grains and the type of grains that we consume, because they are very important for our gut microbiome. In mental health, if someone is struggling with their metabolic health and with their weight, I will direct them towards smaller portions. Have these grains be part of their meal, but not be the focus of the meal. I also encourage them to get carbs from things like their vegetables, so cruciferous vegetables that are very low in calorie and not necessarily going to have as much of an impact because they're more complex carbohydrates, can be helpful as well. But unless someone is allergic or cannot tolerate a certain food group, it's really about finding the moderation, finding the amount that they should consume, and not making that the focus of their nutritional psychiatry plate, but having them have a portion of those whole grains so they still have it in their diet, and tweaking that depending on their mental health, but also their metabolic health. Fermented foods I mentioned earlier, and one of if and when I do consume bread, and I do, I actually like sourdough bread, and one of the reasons it is because it is started with a fermentation process, a fermented starter. And this actually helps to lower the level of sugar in the bread. So wherever I can, if I'm near a good bakery, if I'm traveling and a bakery is actually making their own sourdough bread, it's usually a good option because they're baking it fresh and they're using this fermentation starter. Very different product, of course, from processed sliced bread, which they always kind of say, that you go on vacation and you leave the bread on your kitchen counter, you come back a week later and it's perfectly fine. This is the reason to explain that it's probably pumped up with a lot of preservatives and colorants and dyes and stabilizers to keep it lasting long. What about chocolate? Well, the good news is that dark chocolate, extra dark natural chocolate, we're not talking about candy bars here, actually can help us feel better. A very large population study actually showed improvement in depression when people ate extra dark natural chocolate. And so it's a food that is rich in serotonin. The process of making the fiber from the cacao beans involves fermentation, so there's a probiotic benefit to it, and actually has some good effects. It's also the largest source of plant-based iron. And I think that this is important for us to know because the level of iron deficiency in the world is pretty high. Many people don't realize that. But, it's good to know that these are sources that we can be consuming. The best source of iron is, of course, red meat, but not everyone consumes red meat. So it's good to know that they have this choice. And a little bit of a caveat about the absorption of the non-heme iron is that you need vitamin C to help. And so I always say to people, pair your dark chocolate with a piece of citrus fruit. Now, can we adjust the sugar for our brain health? Well, let's think about that for a second. I think we can. I think that we need to be aware that we cannot consume, a ton of added and refined sugars all of the time. There's a repository that exists online for the last time I checked, 262 other names for sugar and added sugars on food labels. So they often are not recognizable to us. So I would encourage you to learn more about your food labels, understand the amount of added sugars, understand that things like brown rice syrup, which people think of brown rice, I thought that was a healthier whole grain to consume. Actually, brown rice syrup is simply sugar. So just becoming aware of it and understanding that there's a ton of sugar in savory foods like salad dressings and ketchup or store-bought pasta sauces, for example, which you wouldn't expect because it's a savory food. I think that becomes important for us to understand and limiting where we get our source of sugar. I definitely consume fruit. Berries are some of my favorite fruit. I consume it in moderation, but I know that that's a healthier form of sugar than just kind of ultra refined processed white sugar, for example, or table sugar, as it's often called. Now, here's an interesting thought. Certain parts of the world produce beet sugar. While I'm not so crazy about the sugar, because ultimately sugar just is sugar, but beets on their own, just as an aside, beet powder is very helpful because of the constituents it contains that help cardiac health. So this is just a separate side benefit to it. And I think that, it has this beautiful pink color if you're adding to a smoothie or something else that can be just very visually attractive. And the fact that it's good for your body and brain is helpful too. Now, what about foods that fuel the brain? So we've touched on several different foods. We've touched on food groups. We've thought about how do we put together our nutritional psychiatry plate. But there are things like the anthocyanins from blueberries that are extremely powerful. The omega-3 fats from fatty fish like salmon. The prebiotic fiber from things like asparagus. The citrus from lemon. We've talked about the extra dark natural chocolate and the fact that it helped depression in a pretty big population-based study. Leafy greens, different types of greens. low leafy greens are rich in vitamin B9, which is folate, and low folate has been associated with a low mood. And research that was done decades ago. So even though the study was using the supplement folic acid, it is, folate is the derivative, is the natural version of folic acid found in food. So one of the things I love for my patients to do is eat enough servings of leafy greens in their day, because it is such a staple in terms of keeping up with your folate levels. We touched on green tea earlier, and it is really just a good choice for that uplifting feeling, a slight lift of energy, but increased focus, instead of more caffeine at a point when it could make you, more revved up, increase your anxiety, and impact your sleep later that day. And pomegranates are a favorite, just with so many nutrients that are helpful to the gut and to the brain. We touched a little bit on omega-3 fatty acids, but the reason I always include this slide is because many people think omega-3s and they think, fish immediately, but not everyone consumes seafood. So some vegan sources are flax seeds, chia seeds, and these others. And also there can be a vegan supplement that people take if they don't consume seafood. Omega-3 fatty acids, super helpful for brain health. And certainly something worth adding into a diet in an easy way, just by a couple of times a week eating something like a salmon. Canned salmon is an option, is a effective option as well. So thinking out of the box about these things. Baking or cooking with spices and herbs. This is super important. We've touched on turmeric, we've mentioned herbs and spices throughout. But things like passion flower tea, lavender tea can actually be extremely calming for the mind and help anxiety. There's actually research to back this up. Those are things where we need to start to be thinking out of the box. One of my favorite drinks is a golden chai that I learned from my grandmother. It has turmeric with a pinch of black pepper and other spices in it. I now make it with homemade hemp milk, so it's really creamy. And it's a great option just for both calming. It's a great drink in the summer because I can have it iced. It's a great drink in the winter. The recipe is on my Instagram feed. And it's great in the winter because it's a nice warming drink. But all of these actually have so many benefits that are helpful for the brain.
Dr. Naidoo, you are amazing. You're doing really important work. And thank you so much for your time. Thank you for educating us all. Thank you for your books.